Britain's National Health Service is acknowledged as one of the best in the world, and 90% of its acute hospitals use Optilube, a sterile lubricating gel.
They have very high standards in the products that they select and they choose. Optilube is used in many different departments within a hospital environment.
All types of endoscopic procedures, from the upper GI tract to lower GI tract.
Endotracheal tubes, laryngeal mask airways.
For doing rectal examinations on male and female patients.
Performing speculum or vaginal examinations.
With a flexible cystoscope and insertion of catheters.
Nasopharyngeal temperature probes.
If we were performing proctoscopy or rigid sigmoidoscopy, we would always use gel on those devices.
Hysteroscopies and theatres as well.
For A&E and air ambulance doctors treating the most seriously injured patients, having a sterile single-use gel is essential.
So we'll just swap that for the LMA just to maintain them a bit better.
Sterility is very important. The patients that we're using the gel on for an airway procedure are critically ill. Quite often we find these patients have infections that develop over the course of the next few days, and anything we can do to minimise that risk of introducing infection is of course of paramount importance.
Optilube's sterility helps prevent patients acquiring infections in urology too.
It's important to have a single-use gel because you don't want to risk cross-contamination by using the same pot of gel for more than one procedure.
In endoscopy, Optilube makes an enormous contribution to patient safety and comfort.
And we'll then now be able to insert that into the gentleman's anal canal. The dangers of not using any lubricant, in addition to just it being more uncomfortable for the patient, is that you can cause local trauma. So to the anal canal, just tighten the scope up a little bit. And you've really tolerated that fantastically, sir. I can't imagine how we would carry out any sort of endoscopic procedure or indeed a digital rectal examination without gel.
Clinicians working in gynecology and obstetrics also choose Optilube gels to make examinations and procedures as comfortable as possible for patients.
Any vaginal examination or speculum examination can be quite uncomfortable for the patient, and the lubrication helps the speculum go in without causing any micro trauma to the tissues there.
In anaesthetics, Optilube makes a whole range of equipment easier to use.
I use lubricating jelly to aid the passage of these various bits of equipment into their correct position. It makes passing the endotracheal tubes more straightforward, but when you're using two bits of plastic equipment rubbing against each other, it's almost essential to use lubrication in order to put the equipment into the correct place. Not only is it helped me positioning the equipment, but it also causes less pain and discomfort to the patients. There's less bleeding from mucous membranes, and the patients are more comfortable after their operation.
Optilube is formulated in UK laboratories to ensure its physical properties are suitable for a whole range of applications, including urology.
The gel needs to be clear so that it doesn't obscure the view through the urological instruments. You can see it's nice and viscous and it adheres well. Once it's on, you just wipe it around so that you get good lubrication for ease of insertion. If it's too watery, it will just run off the instrument and it won't stay to create that layer between the instrument and the urethral lining.
The qualities and characteristics of Optilube have made it the market leader in British NHS hospitals. It's also used in private hospitals, GP surgeries and pharmacies in the UK, and increasingly with clinicians in 60 countries around the world.
Listening is really important at Optilube Medical, and we spend a lot of time listening and talking to our customers that use the product.
Okay, tube goes in.
Tube is past the cord, so bougie out, please.
Bougie's away.
Round the corner and where I want to be.
Thank you. Very easy progress. He's been comfortable throughout the procedure.
Through listening to the customer, we're able to develop and improve our products to ensure that we're not just sat still, that we're always looking to improve and enhance the products for the clinicians, not just in the UK, but also around the world.